Good morning, everyone. My name is Francisca Menezes. My student ID is S300552. This presentation is a reflective study on the communication and collaboration in a health and social care setting in relation to a case study on Mrs. Turner, a 72-year-old woman with a case of dementia at an early stage of the disease. The fundamental professional skill of health and social care is communication, as it supports the principles of safe practice, person-centered care, and teamwork. Lack of adaptation to the needs of a communication process may result in misunderstanding, emotional distress, and poor quality of care like those living with dementia. This presentation is aimed to discuss how communication styles shape the experience of care that Mrs. Turner had and how collaboration practiced helped achieve favorable results. In its analysis, both verbal and non-verbal communications are considered how both forms of interaction need to be changed to accommodate cognitive changes related to dementia, collaboration between the professionals and family members towards coordinated and effective support. Mrs. Turner is a 72-year-old female that started displaying the symptoms of early dementia during multiple months. Such symptoms were short-term memory lapse, repeating questions, inability to perform familiar tasks, and speech changes, including problems with identifying the right words. This transformation slowly impacted her capacity to communicate well and brought up even more frustration and anxiety. At first, her daughter was confused about this behavior since she thought that her mother was deliberately choosing to disregard the instructions instead of having cognitive impairments. A major problem that was revealed in this case was the role of communication issues as it impacted the day-to-day interaction of Mrs. Turner. She usually got lost when told many things and defensive when told off. This shows the fact that cognitive impairment may change the way communication is received, and a supportive command coming out as offensive. Verbal communication style played a crucial role in Mrs. Turner's experience of care. First, the cognitive needs of her cognitive deficit were not accommodated in the verbal communication of other people around her. She received several or complicated instructions with lots of confusions and anxiety. She would be defensive when the errors were addressed directly because she would feel that she was being criticized rather than supported. This illustrates the negative impact of the use of inappropriate verbal communication with people with dementia and results in emotional distress. Verbal communication strategies were adapted as more professionals got to know about the conditions of Mrs. Turner. Communication was made clearer, simpler, and more concise, and the information was presented at a slow rate. These modifications made the cognitive load to be less and gave Mrs. Turner more time to absorb what was being said. This style is an assertive form of communication in which one is firm and certain and yet respectful and encouraging. Assertive communication is best used in health and social care since it is neither overly emphatic nor too clear. Passive communication can be ineffective in giving enough instructions, and aggressive communication can seem to be controlling or disrespectful. Conversely, assertive communication facilitates the comprehension and encourages dignity. Nonverbal communication was also significant in forming the responses of Mrs. Turner to care. The things that affected her interpretation of interactions included eye contact, facial expressions, body postures, and tone of voice, among others. Mrs. Turner seemed calmer and more cooperative when eye contact was persevered. Open and relaxed body language was employed, and it was discussed in a soft tone. The role of these nonverbal messages was to support verbal messages and contributed to the establishment of some feeling of reassurance and trust. These interactions made Turner more anxious and defensive. Although dementia patients may have a hard time being able to decipher spoken words, they tend to be sensitive to emotional expressions. This implies that nonverbal communication is sometimes more effective than the verbal one. Mixed verbal and nonverbal communication can result in misunderstanding and stress. This brings out the significance of self-awareness in health and social care communication. The professionals should take care of their nonverbal behavior, which might have a serious impact on the emotional well-being of service users. Impact of such person-centered care. The person-centered care involves consideration of the needs, preferences, and experiences of the person instead of just concentrating on his or her condition. The communication had a direct influence on the person-centeredness of care provided to Mrs. Turner. Validation was one of the main methods, accepting her emotions first and then clearing up misunderstandings or confusions. This strategy assisted in calming her down and she felt respectful and understood. Communication led to the optimization of care plans to meet the capability of Mrs. Turner by professionals. Carers ensured that she acted independently by breaking down instructions, giving her more time to respond and speaking in a calmer voice. This assisted in saving her dignity and confidence as they are fundamental aspects of person-centered care. Communication was also used to empower professionals to engage Mrs. Turner in her care decisions and encourage autonomy where feasible. Poor communication may have meant most distress, lack of trust, and independent deprivation. Nevertheless, it is possible to talk about effective communication skills that help professionals to comprehend and address the personal needs of Mrs. Turner. Team collaboration. Team was critical towards giving Mrs. Turner safe, effective, and person-centered care. The multidisciplinary working team on her support consisted of a GP, a nurse, a social worker, and a community support worker who had previous professional skills. Poor coordination enabled the team to come up with a common knowledge about the cognitive loss, communication, and emotional requirements of Mrs. Turner. The holistic approach is vital in health and social care, especially the provision of care to people with complicated conditions like dementia. Effective and coherent communication among professionals empowered early detection of the symptoms in Mrs. Turner and proper referral to be assessed. The communication of information also made sure that every team member knew about any changes in her behavior, memory, and communication abilities. This minimized cases of fragmented care where professionals can otherwise operate in isolation. There was also consistency in approach, speech, and support of Mrs. Turner with the help of collaborative communication in daily interactions. Collaboration and shared goals. Teamwork in the multidisciplinary team facilitated the identification of common goals, consensus on the same, and a successful realization. The goals that Mrs. Turner had in her case were to ensure that she remains independent, enhance her safety, and manage her anxiety associated with early dementia. With the right form of communication, professionals were assured of the realization of such goals by all of those involved, included the family members. This mutual understanding assisted in avoiding conflicting styles which would have disoriented and upset Mrs. Turner. Collaborative planning was the introduction of practical interventions. Environmental modifications, including the labeling of cupboards and rooms, made the environment of Mrs. Turner straightforward and helped her to perform daily activities on her own. The learning outcome is met by demonstrating how effective communication is a concise form which promotes team-based working and the attainment of shared goals. Care will be disjointed without an effective collaboration, which makes it more risky and less favorable. Conversely, the collaborative practice allowed Mrs. Turner to continue being safer, more confident, and more independent in her home. Reflective recommendations. Effective communication and collaboration in health and social care in general, and the support of an individual living with dementia in particular, involve reflective practice as a fundamental element. Considering the case of Mrs. Turner, there are some aspects where the communication and teamwork might be enhanced. A recommendation should be given is the continuous delivery of the dementia awareness training to the professionals and the family members. As much as good strategies applied in this case, dementia is a progressive disorder and changes in communication requirements are possible with time. Continuous training would ensure that the staff members would be confident in changing their styles of communication, such as the use of simplified language, right nonverbal cues, and validation techniques. Education and emotional support should also be used to ensure that they get strengthened on family involvement. Constant mentoring could facilitate the creation of a more positive communication, minimize frustration, and build stronger relationships. This practice advocates person-centered care by appreciating the contribution played by family members to the well-being of the service users. In conclusion, another aspect of professionalism and family interaction that leads to favorable care results is reflected in this case. The multidisciplinary teamwork allowed sharing information using similar approaches to care and introducing practical interventions to safety and independence of Mrs. Turner. Thank you everyone for listening.